Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hey there, nurses, future nursepreneurs, and current nursepreneurs. Welcome back to the Conversing Nurse podcast. I'm Advocate Maggie. I'm the CEO and founder of Advocates for Nurses. So thankful to be a co-contributor not only to the podcast, but to also writing articles. And that's actually going to be the subject of the podcast today, Nursepreneurs Staying in Your Lane to Ensure Ethical Practice. I had the opportunity to write this article, so please get on over to Nurse.org. Check out that article that I wrote, and there's several other that I've written and will continue to write. As nurses, we are innovators, we're creators, we're the scientists, and even recently, I had the absolute opportunity to hear a nurse call us nurse engineers, and it just made my nursing heart swell. This was at the VIVE 2025 conference that was Nashville, and I had the honor to go under Nurse.org with Redonda Vaught. So a huge thank you for sending Redonda and I to the VIVE 2025 conference. I can't tell you enough, and this plays right into Nursepreneurs. Seeing the nursepreneurs on the floor, having the opportunity to interview nurses like Kelly and Samu and Jessica, who had kiosks that were on the floor under Nurse Approved. So be sure to check out even the article that one of my peers wrote, Shannon Lund, and even myself, talking about the nursepreneurs that were highlighted on the showroom floor at VIVE. We are all amazing. We are inventors, we're creators, and we're always pushing the envelope, filling the gaps, solving the problems like no one else can, because we're the end users of everything. But this is where Advocate Maggie's spidey senses start going off. And anyone who knows me knows that after, my journey to include not only being a nurse for 25 years in critical care, but also my unique experiencing spanning across settings like the intensive care unit, from level 1 trauma centers all the way to rural communities, ICU, ER, pre-op, PACU, endo, IR, cath lab. I say everywhere but labor and delivery, and no disrespect, but by choice. And I also have had spent time at a board of nursing. I was trained as an investigator. I've been a legal nurse. So when I say my spidey senses start going off, it's because even as a nursepreneur, you have to stay in your lane. I've been a civil expert. I've been an administrative expert. I've seen nurses reported to boards of nursing or even involved in different types of litigation when they became, nursepreneurs, or even being a bedside nurse or clinical nurse. As, one of my mentors, pointed out, there is no such thing as a bedside nurse, as a clinical inpatient nurse, or whatever your modality is. So no disrespect there. But even, in any setting, understanding your scope is just really, really essential. So in the article, I go over staying in your lane as a nursepreneur or as a nurse. Our roles can be very vast. They're changing. Things like telenursing. You have to make sure that you know the rules and regulations and that you're staying in your lane, as I reference in the article on Nurse.org, because this will be the subject of any kind of litigation that you could be involved in if you're practicing as a nurse and you don't hold a license in that state. And this is the stuff that we're going to talk about in the Conversing Nurse podcast in the next 20-30 minutes. And the goal is to provide you with as much education as possible. I'm not a lawyer. I am a nurse, just like most of you. I've had a unique experience, but you should always be involving legal counsel when developing a business, setting up a business. Even as a nurse, you should have professional liability insurance. And some of the common things that could prevent nurses from getting into trouble and not staying in their lane could be easily solved with involving a lawyer, ensuring that you're setting your practice up as it pertains to your modality, or getting with a nurse practitioner group that already does this, and making sure that, oftentimes they have a lawyer as well, that you are, for example, opening up a practice and you're a nurse practitioner. They already have things that are in place that could be very valuable to you. So don't reinvent the wheel. And let's talk about some examples. So we're doing all kinds of amazing things, to include like IV hydration business. This is a great opportunity for a nurse to branch off. And so I think by now we have all seen that they are popping up everywhere, which is great. I think that at the track here in Austin, they were doing some kind of IV hydration and run by some nurses. All very innovative, created. Kudos to those nurses. I think that that's, phenomenal. Some things to think about when you have this type of business. It's exciting. I know that there's franchises, they'll reach out to you, but did you check your board of nursing rules and regulations? Did you check the board of pharmacy? Can you mix drugs without a hood? Do you need additional certifications? Are you aware that in many states you might need different equipment, like I said, to administer or to mix fluids? Let's just say a sterile hood. Those are all things that when you're setting up your business, depending on the state that you're practicing in, IV hydration business is one where the clients will be right there. Very different, some of this remote stuff, which we're going to talk about. It's really important that you understand these kind of nuances in the state that the client is in. IV hydration, you're going to be dropping a line, they're going to be right there in front of you. You have to make sure that you have a license in that state, that there are some policies, because that's one of the first things that's going to be subpoenaed if anything goes down. Procedures, you're adhering to all the rules and regulations. Reach out, be exhaustive. If you're investing this much money into being a nursepreneur, reach out to the board of nursing, reach out to the board of medicine, reach out to the board of pharmacy, reach out to HHS, whomever it is that could potentially reach out to you if there's an incident. Now, I realize you might not be able to cover all those bases, but try to be exhaustive as possible. And this is why the legal counsel is just going to be very valuable to you, because you know what they've already done? Figure that kind of stuff out. Now, if they haven't, now me personally, if they don't have a position statement from the Board of Pharmacy, Medicine, Nursing, let's just keep on down the IV hydration. You can reach out to the Board of Pharmacy. You can reach out to the Board of Nursing. You can get it from AKA the horse's mouth, right? And just say, am I allowed to mix drugs in the state of, into whatever state you're in, how many drugs you're mixing, possibly what drug you're going to be mixing, and, IV infuse it. So then you have it right there from the horse's mouth, and you can develop a policy even around that. You can give that to your legal team. You can suggest that the legal team reaches out and asks those questions. If they're not a nurse or a healthcare provider and they're not sure exactly what the language is, then that's where you come into play. Provide some of that additional language so that you can both ensure that you're protected. Write the language for them, asking things like, how many drugs can I mix? Because those are things that they may not know. Do I have to mix this under a hood or not? Those are things that I hope are on their purview, but they may not. Can I mix these drugs together as a RN, NP, whatever your modality is, and try to get it down to those nuances? So if someone comes around, there's any kind of litigation, you're like, whoa, hey, so it looks like on February 21st, whatever day it is, 2021, it looks like I, reached out to this entity. This is what I was told. I've kept up with the education, training, and knowledge, and we're going to go into further detail with that. I'm uncertain, please give me some more guidance, but it shouldn't be punitive, especially if it could be a change in a regulation that now says that you can't do XYZ. So again, really important that you're understanding and keeping up to date with that as well. And having legal counsel, not a bad idea. Let's move on to one of the other ones I touched on, and which I'm doing some myself as well under nurse coaching. This is another real hot topic. I love me some nurse coaching. I think that we all need some coaching in our lives, and it could be so many different types of coaching, from wellness to fitness. For example, let's just say you're an RN and you're starting a coaching business. You're helping people live healthier lives. Kudos to you. Let's take the burden off the healthcare system. And the clients that you're offering your services to don't live in the state that you live in. Can you speak to them? You can if you have a compact license. So as a nurse coach, you cannot coach in states that you don't hold a license. Now, some caveats. Again, if you have a compact license, and let's just say I live in Texas and Nebraska's a compact license, the client that I'm nurse coaching is in Nebraska, can I use the word nurse and coaching in the same sentence? Yes, you can. Let's just say I'm in Texas and the client is in California. Can I use the word nurse and coaching and I do not hold a license in California? No. So you have to make sure that wherever you're speaking to that client, that you hold a license. I would also encourage you to check out your license. Do you have a single state to practice? Do you have a compact license? Be sure that you check that out. And the compact list is ever growing. So make sure that you just keep that list up to date, because who knows, you could even be expanding your business because now another state came on board and now you can nurse coach in that state. Let's go down just a little bit of another rabbit hole here as well, as it pertains to some nurse coaching. Let's just say around wellness. You're a nurse coach, you've gone and done some kind of national training that is allowing anyone to attend. RNs, MDs, NPs, NDs, all the letters can attend this education. They can take the certification. They can open up their own business. And maybe they've given you some templates, some tools that you can use in your own business. When you go back to the state that you're practicing in, you have to make sure that you adopt all of your templates, all the language around what you're going to be offering in the state that you hold, states that you hold professional licenses or license, adheres to your scope of practice. You have to make sure that you go through all the forms. Maybe you're going to put up a website. You have to make sure that you and your lawyer, and this is the opportunity again, where your lawyer is just completely invaluable, goes through the language that's going to be put up on the website, goes through agreements, helps you with a contract that specifically aligns with your scope of practice. For example, you're an RN, you want to open up a wellness business. Can you do this? Absolutely, you can, and you should. You are trying to just, keep people well and out of the hospital. Again, kudos to you for, decreasing the burden on the healthcare system. During this coaching with, let's just say, client Sally Smith. Sally Smith has a lot of comorbidities. She's on a lot of medications. You think that she needs to have some labs drawn. You think that this supplement or that supplement or a tweak here and there could help her. As the RN, are you ordering labs? You are not. Are you using that language? You are not. Are you allowed to advise or prescribe medications? You are not. Can you provide educational resources to patients or clients? You can. But all the CYA, and we all know what that means, right, should be around. You have to make sure that anything and everything that you do is checked off with every provider that you ever have had and whomever is managing your care. Anyone who's prescribing you medication, seeing you, you have to make sure anything that you do based on the education. Let me say that again. The education that I provided you, because I'm the RN, is checked off by your provider. I am not telling you to make any medication changes. I'm not suggesting that you make any medications. I'm providing you with some educational information that you and your provider might want to take a look at that might be useful as you manage what I hear you say, and then you insert whatever their concerns are. But you're not ordering lab tests and you're not prescribing supplements as an RN. If you're a nurse practitioner, that is way different, but you also need to make sure that if the cardiologist has written for, something, whatever it is, let's just say Zocor, whatever we're using these days, whatever medication we're using to lower, cholesterol, and you think that the adjunct of another supplement may help and maybe even get them off of this prescription medication. I think that's great. The language always has to say as well, to protect yourself, please reference, or consult with your managing provider, whomever is prescribing you this medication, is managing this disease process. This is for educational purposes. Please take this back to your, provider, do additional research, education, sign here. Seriously, need to have a lot of CYAs that pertains to that.
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
Something that I did not touch on in the article, but I think is really important to discuss, is that if you hold a doctorate and you're a provider, because there are different degrees, and you have doctor in front of your name, please make sure that, again, in the languages of everything that you have out there, that's in nursing, that's in nursing, that's in nursing, that's in nursing. Because I've seen, and I think at this point, all of us across, anyone who's on social media has seen where nurses have been reported to boards for quote unquote misrepresenting themselves. And oftentimes it's just a miscommunication or misunderstanding of patients who don't understand that our degrees are just growing. Think about this. And I mean, this is on Nurse.org website as well, with all the schools. Just the leaps and bounds of the opportunities that are out there for nurses and all these vast, amazing degrees and opportunities confuses patients. So make sure that everywhere when they walk into the practice, everything that they sign, work that into your language as well and your staff's language as well, making it witty. Remember, I'm a doctor of nursing, whatever it is that your degree is in, so that there's no misunderstanding, that you're not misrepresenting yourself. So I don't want to, keep going on with that, but I just want you to be sure that you protect yourself when we have all these amazing degrees and you're using words, like doctor and coach, and depending on what state you're in, please make sure that you pause and you understand what states you're licensed in, even as a nurse practitioner, especially, when you're, writing prescriptions for patients that are in other states. Be really conscious of that when you're opening up a practice and you want to coach in the state and you want to practice in the state that you hold a license in. You can apply for endorsement in any state that you want. You'll have to meet that criteria. Just make sure that you reach out to them. All the states, I presume, and again, I'm not sure, are looking possibly at compact. I think at one time, and I'm just looking at just like the trend of all the ones that have come on board, more likely than not, a good portion of the United States will all fall under a compact license. So make sure that you understand that, which states fall under that, because that could also expand your business as well. The other little caveat here around coaches is there's life coach as well. So if you are speaking to a client, and you need to make sure that you understand that board, and that's not my wheelhouse. You need to make sure that you understand that education. When you do that, if there is a client in a state and you're not licensed, there is stuff around life coaching certification and that type of board that sets that criteria that you can most certainly look into to see if you can use that word in states where you don't hold a professional license, and then making sure all your policies, everything that you provide that patient in that state or that client in that state, the language says that you're the life coach and not the nurse coach, because language does matter. So let's move on to who doesn't love, little med spa? Who doesn't love to have a little nip tuck, a little injection? Again, this is a growing place where oftentimes nurse practitioners are opening practices, and then RNs are taking additional training and education to learn how to inject. This is amazing. Allowing nurses to fill their soul. Maybe you're not going to pick up that extra shift in your unit or wherever you're at, but you're going to pick up shift doing or learn a different skill to help fuel, your nurse soul so that you stay within an inpatient setting and you're not leaving. So this is a great opportunity, and let's just talk about this. It's essential to know that state rules and regulations, if you're a nurse practitioner, may require that you have oversight. If it's a surgery center, again, that's falling under a lot of other rules and regulations. This is why you need a lawyer to make sure that you're aligning with whatever those are. Some of these chemical peels, and I am no expert in this, but I have recovered patients in surgery centers that were having different forms of aesthetics. Oftentimes it's the peels, it's the laser that required them to have some sedation. And so now they're in a surgery center, which kudos to anyone who owns these places, spas that affords that ability. But you have to make sure that you're meeting those rules and regulations, because now you just layered on something different, right? A surgery center, procedural stuff, getting with a lawyer when you're doing this stuff. Absolutely. You should look into this. I think this is great. You just have to make sure that you're adhering to all the rules and regulations, because there's going to be more than just the board of nursing. And again, getting legal counsel. Do some basic research as well. I always encourage nursepreneurs to do two things. Look at litigation, lawsuits. Google, this is simply Google, around whatever you're trying to start. Legal cases, insert the state. Let's just say Texas, because that's what I'm at. Involving, let's just say, a nurse at a med spa. And there you have some cases. You know what you're going to look at? What you're not going to do, right? You're going to do the opposite of that, and making sure you're getting with your legal counsel and saying, hey, can we make sure that we don't do that? Maybe it is you develop out another policy, procedure, you change up some stuff. So I've seen nurses reported who own spas, and it could be oftentimes even by their competitor. And one of the things that did save them was that they had policies, procedures in place. So remember that you have to make sure that if anything happens, you have things in place. You have to make sure that at every level that you're protecting yourself, and why doing that simple search and having legal counsel alongside you who will oftentimes know, because that's going to be some of their specialty, some of the tricky situations or litigation that other nursepreneurs who were in your same or similar type of business, aka med spa, did, and you're going to do XYZ to make sure that doesn't happen. So get legal counsel. That it's no joke. And as the owner of the practice, and it doesn't matter what practice we're talking about, you get a subpoena, let's just say if it's the board of nursing, and then the practice does. So both you as the provider and as the practice owner, and you'll be asked to produce things like policies, employee files, whatever it is that they're asking about. You'll have to produce that. So I think I beat that horse, right? So I think we're good with that. Stay in your lane, making sure that you have legal counsel, you have policies, you have procedures. You have to make sure as a nursepreneur, inventor, creator, you're staying in your lane, that you have things lined up, you have things that protect you. I really hope that this has been informative and that you provide comments. Be sure to get over to the Nurse.org website. You also get to see the nurses that were showcased, not only in this last cohort under Nurse Approved, but even the previous ones. And I actually was one of them. So be sure to get on over to Nurse.org. Like I said, Shannon, one of my peers, wrote an article highlighting the nurses. I am writing another article highlighting the nurses that were there in February that Redonda and I had the absolute opportunity to spend some time with. And they're highlighted in the nurse.org article. So make sure that you get on over there. Big shout out to them again for creating such a cutting edge platform that's offering resources that I don't know that they're offering anywhere. We are amazing scientists, innovators, creators, And thanks for tuning into the podcast. I'm Advocate Maggie. Until next time, not only stay in your lane, but stay safe out there, nurses. You are amazing. What you do matters. Knowledge is power.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.